thank you very much. I'm Dana McGuire, the Public Health Director for St. Lawrence County. And today I'm just going to take you through what we've seen in the last year for the COVID-19 response here in St. Lawrence County. So for this presentation, I'll talk about the current response activities that we've been doing. We'll look back over the last year at a few key milestones and some of the activities we've been through. We did a quick survey of some key stakeholders on lessons learned and silver linings. So we'll talk about those and what we've learned from this response. And then briefly, where do we go from here? So currently, and for most of the time during this last year, the response activities that the health department has taken on has been case investigation and contact tracing. So for those who have tested positive and those who have been exposed to someone who has tested positive, we've provided consultation and the guidance to a whole host of stakeholders, from schools to nursing homes to businesses, to help them with their reopening plans, making sure that they had everything safe. And then we've been just taking in that guidance that we receive from an executive order or from the New York State Department of Health and try to interpret that and pass it out so that we can move forward as a community. And then most recently, we've been involved since the new year with the vaccine distribution and administration. And through all of this, we've had a call center. So if you had questions on your isolation or on your quarantine, if you wanted to hold an event, if you need help with registration for that vaccine, we've been there to help the community as well. And so when we look back at how we had to get started for this response, is really looking at, well, gosh, what does COVID-19 mean and what are we going to need to do? So we really had to look at who were our partners and what would be needed. And while our department has experience in case investigation and contact tracing, because we have the communicable disease program, it's really been a while since we here in the county have done isolation and quarantine. So we had to update that plan we had. We had to think about how we were going to ask questions for those who tested positive and those who were exposed, so that we could see if they would need to do isolation or need to do quarantine. We had to look at how we were going to provide orders to those folks. As it is a public health law that you do maintain your isolation or your quarantine to try to contain that virus. And then during all of this, because people were going back to work, we had to think about who was an essential worker, who was going to be that essential worker at work, and think about who might be exempt from a quarantine process and how we would go about that. Through the whole process, like I mentioned before, there has been guidance coming almost on a daily basis of how to manage this response from isolation to quarantine, what those definitions mean, what it means to reopen. And so there's been executive orders and guidance from the New York State Department of Health that we kind of take in and make sure that we can get to the community. Starting last spring, there was reopening plans. We helped all sorts of stakeholders, from businesses to schools, for people who wanted to do activities so that they could create a safety plan so that everyone would be safe. And throughout it all, we've been working with the schools and the colleges, talking with them when they needed to close down, when they did the reopening plans, and all sorts of things that have kind of come up since they've been back in session this year. So how do we get all of this done? It's not something one department can do, one person can do, but we have asked for help from just about everybody. So we have had people from the other county departments, from within our own department, those folks who don't normally work on the public health side or who have never done case investigation or contact tracing. We all became trained here in the department, whether it was just trying to figure out how to do the social distancing here in our office, in the other county buildings, or just trying to help other stakeholders for flow and signages, looking at how we do things just to keep people safe, to keep people distanced. I mentioned the call center. So, we have a lot of questions coming in. And now with the pods, and the pods are the points of the distribution. So we can get vaccine out to everyone here in our county, which is it's the largest one across the state. So we want to make sure we can get that vaccine to all points here in St. Lawrence County. And then also just all of the deliveries that have been needed, from making sure that someone has their order for isolation, making sure they have needs when they're on isolation or in the quarantine process, or just trying to get things from one place to another to make sure that we have all of the PPE. So we have gotten assistance in almost everything we do from just about everybody. And when it comes to the pods that we've been holding, not only is it our stakeholders and other county departments, now we had a call on Serve New York just to get volunteers to work the pods, whether you're like a medical provider or a non-medical provider. And so we have multiple people from the community who want to be helping out to make sure that everyone gets vaccinated. And so it's really been great just to see all of the support that we have had through this response. So let's take a look at where we are today. So as of yesterday, we have just over 6,500 cases, with 67 of those being active, meaning that we're monitoring them in isolation, and over 6,300 who have been through the isolation process. We currently have 3 of our cases in the hospital, and we'll talk about where that number is now as compared to what we've seen through time. And since we started this response in March, we have had 93 deaths here in St. Lawrence County. So here is a curve I like to see, or to show, because it really shows since March 25th until now on a daily basis. And you can see that we are showing a downward trend. And in the last 2 weeks, this is what we're seeing, which is great. And I hope that it does continue. With our hospitalizations, as I mentioned, we're currently at 3, and you can see I put a yellow bar across this graph, and we have not seen 3 hospitalizations since before the November time. Our highest hospitalization day was on the 26th of January, where we saw 42 of our cases were in the hospital. So it's nice to see that that trend is decreasing as well. When you look at our curve from a weekly basis, so I first showed what happens on a daily basis, and it's getting quite wide because it's been such a long response. But when we look on it on a weekly basis, it kind of zones it in a little bit. And for the last 4 weeks, you can see that we've seen a significant decrease in the cases. So our weekly cases for this last week of reporting, which for us always goes from a Wednesday to a Tuesday, because our first case was on a Wednesday. This last week, we saw 46 cases, which again, you can see has been a lot lower than we've seen for most of the time since November. When you look on our daily average cases, this past week, 6 of the 7 days in this week have been under 10. And again, that line shows that we have not had an average daily case rate of under 10 since before November. So you can see that steep decrease since the January time, which we do hope continues. We have been working with the K-12 schools, and so you can see that after the holiday break, there was a steep increase in the cases, where in January, the average weekly cases were about 77. And in February, they were 50. And now in March, we have an average of about 19 school cases per week. And that includes both students and staff. So that has been a nice decrease to see as well. We've also been working with the colleges, and there is a steady decrease since the second week in February, where you can see there was a spike of cases on college campuses, up to 130 cases for that week. So that's been really nice to see that decrease. And we actually meet on a weekly basis with all 4 colleges, talk about the cases they have, any of the new guidance that does come out, and then any problems or concerns that we can work on as a team. With regard to the vaccine distribution and administration, we work with the North Country Hub. And so this dashboard is from that North Country Hub, which is led by the CVPH Hospital. And so we meet regularly with the hub to talk about the allocations that each county does receive and what administrations we've been doing, and talk about whether any transfers of vaccine need to occur because we're not able to provide them out, and just try to work through those populations that might be more challenging to reach. So here on the left side of the slide, you can see just vaccination that's been done by all of the 7 counties within the North Country region, and then the allocations that we've received during the weeks that we've been able to do vaccination. And so allocations have increased over time. There have been some weeks where there's been some of the fluctuations, but you'll see when I show you what we've done here in St. Lawrence County with regards to a point of distribution or a vaccine clinic, that our administration has went up over time as well. With regard to the state as a whole, the North Country region has done just really well with the administration of both the first and second doses. So here is what St. Lawrence County has done so far, and this is again from the dashboard of the North Country Hub. We have provided over 55,000 doses, with 33,000 of those being just the first dose and 21,000 being second doses. So of the population that is eligible in St. Lawrence County, which includes everyone who is at least 16 years or older, we have vaccinated for first doses 38%. And about 24% of those who are eligible have been through the entire series. So we continue to increase each week. What you can also notice on this graph is the type of vaccines that we've been able to provide. So the blue shows the Pfizer, and most of that is done by the state site at SUNY Potsdam. And the yellow is the Moderna, that is mainly done by us at the local health department. And the pharmacies. And you can see there's been a small supply of the Moderna in an early week in March. And so that supply has decreased across the state. And we have been told that in the upcoming weeks, we will see an increase in that as well. And we are looking forward to that so that we can reach populations that may be more challenging, say like the homebound, where we would only need to do 1 visit instead of doing a second dose either 3 or 4 weeks later. With regards to who has been vaccinated, you can see that it's almost 50% males to females, but slightly more females have been vaccinated. But where we've really done well is those who are aged 70 years or older. And so they're up and above what the population level is, which is great, because this is the population that we really worry about the effects of COVID-19. So we are trying hard to get those who are at more risk for poor outcomes should they test positive. This is also a nice map that the North Country Hub does put together. So it on here, it has the hospitals listed, where low-income housing, where the senior housing is located. And then it shows the areas or townships of where vaccinations have occurred. And you can see that the more green that you see on the map, the more percentage of people have been vaccinated with that first dose. So we are doing quite well. And as we hold county pods, or those points of distribution, we work to hold them in multiple areas, whether it's Ogdensburg, Messina, Star Lake, or like the Gouverneur area. We want to spread them out to make sure that each person in the county has the opportunity to be vaccinated. We are also fortunate here to have the SUNY Potsdam state site so that they can supplement the work that we are doing. And then also we have the hospitals who kind of early on did a lot of vaccinations. And then also the pharmacies through the federal program have done nursing homes. And then at the store locations have done a lot of the elders. And so they have been very helpful in helping us to get our percentages of those vaccinated to be very high. With regard to what we've done here in St. Lawrence County as our own pods for the local health department, this graph shows that both first and second doses do continue occur very steadily. And it really depends on the allocation that we receive for each week. So during the first weeks in January time, where we only received about 200 doses per week, that's what we saw. We have had weeks where we've done up to 400, 500, or 700 people, but that's based on how much allocation and what the supply of the state has been. Early on when we had pods, we were required to make sure our allocations went to certain groups. So if we were allocated 400 doses, 200 of those could have been for the essential workers, and then 200 we would have had to make sure went to those with a comorbidity. And specifically for a few weeks, the state wanted us to focus on those with disabilities. So those who lived in a home or worked in a home for that population was where we did focus. And so while we were trying to target those populations, it also made it a little bit more challenging because we had to have different registration links for those groups. And so in the last few weeks, we've been able to take all of our allocations and just put it to those who are eligible without having to separate them out. And I think that that has made the registration process just a little bit easier. And then also, as you parse out those populations, it gets difficult to provide because those groups get smaller and we try to move around the county. So things have changed as the supply has increased for the state. The eligibility for vaccine has changed. So this is, we just finished the 10th week that we've been doing vaccination for the county. And the newest populations who are now eligible for the vaccine are those who are 50 years and older, and those who have a public-facing government or a public job, or those essential building service workers. So those are the new groups. And these are all the groups that we as a local health department have been focusing on. One of the areas that we really have tried to focus on is those with comorbidities. So there are 13 categories of health conditions that would make you eligible for the vaccine. And we want to make sure that everyone understands what that means. And so we've tried to provide more information because there are so many people that may have high blood pressure, that may be overweight. And some of these medical terms sometimes can be difficult to understand, or people might not know if what they have. And so we want to make sure that people do call their healthcare provider and ask questions. And the registration process is complex. So if you have any questions, you can always call the public health department for that assistance with the registration process. And this is really important to get this education out because this is the largest group so far that's been eligible, because about 50% of the population here in St. Lawrence County does at least have one of these health conditions. We want to make sure that people know that they could be eligible. So as we look back over the past year and how this response all kind of rolled out, I just wanted to go through a few milestones of how things started here in New York and for St. Lawrence County specifically. It was on the 1st of February last year, we had our first call with the Department of Health to learn about COVID-19 and what the processes would be for isolation and quarantine and the importance of an order and all of that. And so starting to talk about what plans needed to be updated and put into place and what partners were going to be necessary. 2 weeks after that, we actually did have our first quarantines, and this was due to a travel from out of the country. So we were able to start using our plans. And March 1st was the first case in our state. On the 16th, we did have a state of emergency that was declared here in St. Lawrence County. That was before our first case on March 25th, and when schools did close. 2 weeks after our first case was the first death. And before the first month of the response, we had already had 100 cases. Some of the other things that happened through the spring were the executive orders on mask wearing. So it was now required to wear a mask when you went out in public. And also employers were required to provide masks to their employees. In that springtime, there was an outline of what was going to be needed for a phased reopening plan. And we were also told at that time that schools would not be reopening for the rest of the year. Some essential groups required special testing. So nursing home employees needed to, at the beginning, be tested twice a week, and that then went down to once a week. But there were other essential workers, like those that worked in a hair salon and things like that, for reopening to happen, that we were providing guidance to and making sure to work with businesses. By the end of May, we had 200 cases. And by the end of June, we saw the travel advisory. So for anyone coming back or traveling to a state at a higher risk, you'd need to quarantine for 14 days. And that list of states would change on a weekly basis based on the positivity rate in that state. Through the summer, we actually saw a great decrease in the cases we had here in St. Lawrence County. We had many weeks after a while that we didn't see any cases. And this is where guidance was coming out for schools to reopen, so K-12, for the colleges to reopen. And that's when we started meeting with these groups on a regular basis to discuss the reopening plans and what it was going to take. And then also for colleges, for the testing of students and staff on a regular basis. Mask wearing was something that we still wanted to focus on and make sure that everyone knew its importance. So we did a campaign, and that was really great because we used a lot of departments, and we were able to engage just a lot of different agencies to work on this. And now you can drive around and see the billboards still that show why you wear a mask. We also had guidance right before the fall on doing inspections of fitness centers. And as a partial service health department, we're not used to doing inspections because we don't have the responsibilities to do restaurants and beaches like larger scaled health departments. So that was one thing we had to learn new and work with those fitness centers to provide them a template and then do inspections to make sure that they could open safely. We did have a cluster due to a worksite exposure in the Messina area at the beginning of September. So we did have one state pop-up testing site that day to try to make sure we could contain that cluster and learn who might have been exposed. At the end of September, we were still working with schools and dealing with the schools being opened, and we were starting to see a few increases. And so we were able to have a state hired school specialist. So counties had the choice to take this person on, and they were like the liaison between the state, our department, and the schools, and would help us to work on those students who may be symptomatic going to school. Because as I move to the next slide here, it was at the beginning of October that a K-12 toolbox was put out. And for anyone who is symptomatic, whether it was a student or a staff member, they'd have to stay home, they'd have to see their provider, they'd have to get tested. So we were working on those things. So the school specialists really helped with that guidance. And then as we move into the fall, when you see that we really increased, they've been very helpful with case investigation and contact tracing as well. It was early in October, we started discussions about the vaccines that we would see, what would be coming out, what would be needed for storage, what would be needed for the training and all of those things, and to put our plans in place so that we could hold pods or points of distribution for the community. While we were meeting weekly with colleges, we also met weekly with school nurses to talk about the guidance for any issues they were having with the schools for the symptomatic kids. And then there was regular guidance coming out, with testing. And we never became a county that became part of the cluster, the initiative where testing was mandated, but we were starting to get those processes in place should we need to do that. By the middle of October, we also heard word from the state that we could get assistance from the state virtual team. So the virtual team would help us to do contact tracing. And so in the spring, we had trained all of our department, we had gotten some external volunteers, and we had moved from a paper version to a computerized system called ComCare. So all of our cases and all of our contacts were within this system. But we also had to be ready should there be a surge that we had heard about since the spring in the fall time. So that virtual team did start to help us. By the end of October, we had 400 cases in St. Lawrence County with 4 deaths. And by the beginning of December, we had 1,000 cases. So you can see that in the fall time, we were really starting to increase. And the focus was really trying to get done with case investigation and contact tracing just as fast as we could. And by the middle of December, when that increase just kept coming, we also use the virtual team now for case investigations. So there was a time right around Christmas and New Year's, we had a delay in getting to people for case investigation and contact tracing because that rise was so steep. And so by having the help of the virtual team, we were able to get rid of that backlog. And you can see by the Christmas time, we had 2,000 cases in the county. And on New Year's Eve, we had our first day of 100+ cases in one day with 153 cases in one day. So just trying to get all of the case investigation and all of the contact tracing that needed to be done with these high case days was really the challenge as we saw the holiday period. As we get into current where we are right now, starting with the beginning of the year, we had 41 deaths. By the 20th of January, we had our first vaccination pod through the county. And since then, March 1st, I see we have had 10 pods held. We've now had about 17 pods. There was a time in January, which was our highest case month, that we had 1,200 active cases. So over 1,200 people were actively being monitored in isolation due to being tested positive. January also did have the highest hospitalization day at 42 hospitalizations. And by the beginning of the next month, we had 5,000 cases. Like I mentioned, we're having more and more pods. We're starting to see a light at the end of the tunnel. We have administered just over 3,500 first doses of the vaccine and just over 1,200 of the second doses. And so we are really doing well to get vaccination in arms here in St. Lawrence County. So through this year, it's been a long year. It's been exhausting. It's been really challenging, but we've learned a lot from this. And, when I did the survey, I asked people to tell me what lessons they've learned, what the silver linings were, what opportunities they've had, what some of the challenges were and some of the strengths were. So I'm going to just try to highlight some of those. It was hard to pare down because there was so much good information. But for lessons learned, the one key thing that came across time and time again was the communication that's needed. It needs to be often, you need to be patient, and you need to provide that information. The more information we could provide, just the more informed people would be. So from our stakeholders to the community at large, that was really one of the most important things. We found that the infrastructure was not ready to go and not ready for the length of time that this response would take. And we learned how to do just many things in many different ways. And many times we did a lot less than what we had before. And that was okay. We learned that being apart actually pulled us more together. We also found out that rapid contact tracing really works. You can really try to contain that exposure and try to prevent the spread of the next case with contact tracing. And that it's important that we stop taking all of the simple things in life for granted. With regards to the silver linings, is one of the things that stood home is working from home and learning that many of the positions we hold can be done from home if you have the technology. And while we were connecting with people, it could have been for isolation, contact tracing, we would learn more if they had other needs, so we could help them get access to some of the other services that can be provided here in the county. We had to find many new processes and procedures, and we learned that change, doesn't have to be such a negative thing at all times. For opportunities, people reported that they rediscovered things that they hadn't done in a long time, that they were able to go to a park or see what St. Lawrence County had to offer. And that in some cases, doing virtual learning or virtual meetings, people were able to attract an audience that they normally couldn't get to come to things. And so whether it was parents for education or people who are stakeholders that normally can't make meetings, that virtual environment was just very helpful. And Zoom, while there's some downsides, we don't have the connections, it does make us more time efficient, and it can be greener as well on the environment. One of the silver linings that was just reported is that there was more parking spots for those who did have to work on site as well. For opportunities, I think it's been good for our department and all of those in our department who may not always play the roles that they do, but also for the community at large to understand the public health kind of efforts on a grand scale, what it takes to, make a response, and the importance of all of the recommendations and what they actually do. We had to work so often with many organizations towards one goal, with like the mask campaign, with getting information out about vaccines. We're all working towards the same thing. So that was a real opportunity to work with people that we sometimes don't think that we have partnerships with, or we don't think to add them to the table. So I think it's important too for an opportunity to continue to build on and think about what's needed for the emergency preparedness groups we have, and make sure we stay in contact and take everything we've learned now so that we can be ready, for the next pandemic or the next ice storm and things like that. As far as challenges, this has been, it's been a long year, and people have felt very isolated. Childcare, virtual schooling has been very challenging for some. When things start to look better, people are, getting excited to go back to normal. I think it's important that we just make sure we do this in a systematic way so that we don't go backwards and we continue to see the trends that we are just currently seeing. And right now, making sure that that everyone understands the importance of just getting a vaccine so that we can, stop the spread. With regards to the strengths we've seen here in the county, the resilience of, the public health workers, from healthcare staff and the agencies themselves, first responders, and the community at large. In general, we were able to, bounce back and kind of do what was needed to do. We've had so much coordination with so many agencies, from schools, nursing homes, businesses, so that we could reopen, we could carry out just all of the guidance, and all of the support and the communication that we've been able to do has just really been great. And people did feel that there's a sense of a community wanting to do what's best, for our communities, and lots of teamwork. And one thing that was mentioned quite often is the ability to get out as much vaccine that we have just already. And so through this process, we haven't been able to do things like we normally do. So we've really had to think outside of the box. So I came up with a few examples, and I've heard a few as well. But when we think about some of the clinics that we hold in our department, whether it's for flu vaccine or for rabies vaccines for the animals, we've totally changed our process. We have a drive-through process. We have people wait in their cars, and we think to ourselves, man, these processes are just even better than what we did before, but we didn't have to think about doing it different, so we never did. And so that's been a real nice change just to see. There's been a lot of the drive-bys for recognitions, for birthdays. There's been the parades. So trying to do things so that you can see people when we're trying to maintain all of the recommendations as well. We've seen many events be like a drive-in style. There was one report of of the only musical that was done here in St. Lawrence County by a drive-in where you had sound coming through your radio and things like that. We've had virtual meetings, which, you know, can be positive, can be negative, but it is helping to make those kind of connections that sometimes we're not able to, or we're able to make meetings that we're not able to, or we're able to engage patients or some of the families that wouldn't normally just participate and provide services. And then too, we've had to think about new partners. So, you know, the public health department doesn't always think about going to the Chamber of Commerce and asking, you know what, but we've had to have new partners. We've had to get things done. We've had to see expertise just from a different side. We've needed technology. So thinking about all that's needed just to carry out what we've done in the last year has really made us think about doing things very differently. And many of those things we'll keep doing after this response. So where do we go from here? You know, I think it's really important. As I mentioned, one of the things that came through in the survey and what we've learned is we've really increased the communications through the community, through the county, all of our stakeholders. And so I think it's really important we take from this and we use what we've learned. And we've strengthened so many relationships that we've already had, and we've created new ones that I never really thought, you know, we'd ever have. And so I think it's really important that we take this time to foster those so that we can tackle some of the other community issues and concerns that we need to work on here in St. Lawrence County. With that said, though, we are seeing a light at the end of the tunnel, but we're not at the end. So I think it's really important that we have to try to stay maintaining all of the recommendations, to be vigilant and to be optimistic, but careful and very systematic about what we do. And you need to get vaccinated. So you should try to schedule your vaccination as soon as you are eligible. And remember, even after you're vaccinated, it's important to wear a mask when you're with those that are not within your household or who haven't been vaccinated, to wash your hands most frequently, and continue to do social distancing. We do have some of the variants out that we don't know much about, so it's important to keep all of these things in mind. But overall, that has been the response that we've seen in St. Lawrence County. There's been a lot of things that have happened, a lot of challenges, and a lot of new things learned. So hopefully we'll be able to take all of this information and just continue this response until we're totally through COVID-19, and use it for all the activities that we have coming up in the future. Thank you very much.